Hi everybody. Today we are going to cover chapter 14, which is safe sex and contraception. So what we're going to cover today specifically are gender identities and sexual orientations, some myths about sex, safe sex practices, and again forms of contraception. So first we're going to start with some basic definitions, and then I'm going to go through quite a long list of definitions. So the first one is gender identity. Now, gender identity is one's innermost concept of self as male, female, a blend of both, or neither. So it's how individuals perceive themselves and what they call themselves. So one's gender identity can be the same or different from their sex assigned at birth. Now, sexual orientation is an inherent, right, or something you're born with, or immutable, meaning you can't stop it, enduring emotional, romantic, or sexual attraction to other people. So usually we consider this as who you are attracted to. So I want to make the quick distinction between sex and gender. So you've probably, marked this on many doctor's forms or any type of form you fill out. So sex refers to the biological, right, gender you were born with, and then gender refers to how you feel. Gender expression refers to the external appearance of one's gender identity, usually expressed through behavior, clothing, haircut, voice, and it may or may not conform to socially defined behaviors and characteristics typically associated with being either masculine or feminine. Okay, so this is how you express yourself. Most of the time when we think about this, we think about how we wear, or like how we dress, okay, or how we hold ourselves. Gender dysphoria is a clinically significant distress caused when a person's assigned birth gender is not the same as the one with which they identify, so it doesn't match up. According to the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Health Disorders, the DSM, the term, which replaces gender identity disorder, is intended to better characterize the experiences of affected children, adolescents, and adults. Transgender. A gender description for someone who has transitioned or is transitioning from living as one gender to another. So this is an umbrella term for anyone whose sex assigned at birth and gender identity do not correspond in the expected way. So for example, someone who is assigned male at birth but does not identify as a man. Gender transition is the process by which some people strive to more closely align their internal knowledge of gender with its outward appearance. So some people socially transition, where they may begin dressing, using names and pronouns, or be socially recognized as another gender. Others undergo physical transitions in which they modify their bodies through medical interventions. Now we're going to rapid fire go through a bunch more definitions. So this is not a totally comprehensive list. There are many more out there, many more terms I think you should become familiar with. But the best thing we can do is just understand their definitions. Okay. So agender is a person with no or very little connection to the traditional system of gender. Okay, so they don't align with the concepts of either man or woman. Okay, so they consider themselves to not have a gender, pretty much. Androgyny is a gender expression that has elements of both masculine and feminine characteristics. Okay, so they are in between if you consider it a scale. Aromantic is experiencing little or no romantic attraction to others and or has lack of interest in romantic relationships. Bicurious is a curiosity towards experiencing attraction to people of the same gender or sex. Cisgender is a gender description for when someone's sex assigned at birth and gender identity correspond in the expected way. So for example, someone that was assigned male at birth also identifies as a man. Cisnormativity is the assumption in individuals and institutions that everyone is cisgender and that cisgender identities are superior to other identities. Closeted refers to an individual who is not open to themselves or others about their sexuality or gender identity. So this may be by choice and for other reasons such as fear for one's safety, peer or family rejection, or disapproval. Fluid or fluidity is generally used with another term attached to it, like gender fluid or fluid sexuality. Fluidity describes an identity that may change or shift over time between or within the mix of options available. Next, we have some acronyms that are often used that you should understand. So the first one is female to male transgender or transsexual person. So you see the F stands for female, T for two, and then M for male. So this means the person was assigned female at birth and is transitioning to the male identity. And then we have male to female or male to female. Gay. This is experiencing attraction solely or primarily to some members of the same gender. So this can be used to refer to men who are attracted to other men and women who are attracted to other women. Gender binary is the idea that there are only two genders and that every person is one of those two. Heteronormativity. This is the assumption, similar to cisnormativity, that everyone is heterosexual and that heterosexuality is superior to all other sexualities. So this can lead to invisibility and stigmatizing of other sexualities. For example, when learning a woman is married, asking her what her husband's name is. Okay? So this happens pretty often. Heterosexual or straight. This is experiencing attraction solely or primarily to members of a different gender. Homophobia, which is spelled incorrectly, I'll fix that, is an umbrella term for a range of negative attitudes, for example, fear, anger, intolerance, resentment, or discomfort, that one may have toward LGBTQ people. The term can also connote a fear, disgust, or dislike of being perceived as LGBTQ. So homophobic is a word used to describe actions, behaviors, or individuals who demonstrate elements of this range of negative attitudes towards LGBTQ people. Homosexual. A person primarily emotionally, physically, and or sexually attracted to members of the same sex or gender. Intersex is a term for a combination of chromosomes, gonads, hormones, internal sex organs, and genitals that differ from the two expected patterns of male and female. This was formerly known as hermaphrodite or hermaphroditic, but these terms are now outdated and derogatory. So intersex is the appropriate term. Metrosexual is defined as a man with a strong aesthetic sense who spends more time, energy, or money on his appearance and grooming than is considered gender normative, right? So They spend more time on their appearance than what we consider normal. MSM or WSW stands for men that have sex with men or women that have sex with women. This is often used in the field of HIV/AIDS education, prevention, and treatment. Pansexual is a person who experiences sexual, romantic, or physical attraction for members of all gender identities and expressions. It's often abbreviated to pan. Passing is a term for trans people being accepted as or being able to pass for a member of their self-identified gender identity. This is regardless of sex assigned at birth, without being identified as trans. Polyamory or polyamorous refers to the practice of, desire for, or orientation towards having ethical, honest, and consensual non-monogamous relationships. So in essence, it's relationships that may include multiple partners. Queer is an umbrella term used to describe individuals who don't identify as straight and or cisgender. Due to its historical use as a derogatory term or a negative term and how it's still used as a slur in many communities, it's not embraced or used by all LGBTQ people. Transsexual, a person who identifies psychologically as a gender or sex other than the one with which they were assigned at birth. Transsexuals often wish to transform their bodies hormonally and surgically to match their inner sense of gender or sex. Lastly, we have transvestite, a person who dresses as the binary opposite gender expression or cross-dresses for one of many reasons. This could be simply for relaxation or fun or sexual gratification. And this is not to be confused with transsexual. Okay, transvestites merely dress as the opposing gender expression. Now we're going to go over some general safe sex practices. Okay, so these can be used by any person, no matter their gender orientation or their sexual orientation. Okay. So the first thing is to avoid STDs. Right? You should use any type of barrier you can. Right. So that could be a dental dam, which is a rectangular barrier that you can place over genitalia while performing oral sex, or you can use condoms. So there are both internal and external condoms. External condoms are what we would consider male condoms, and there are also a female version that are used internally. You can use gloves, right? So you should use any type of barrier you can every time you have oral, anal, or vaginal sex, or do anything that passes sexual fluids. Okay, so this includes sharing sex toys. Okay? So anytime you can, use a protective barrier. And internal condoms, like I said earlier, they're often called female condoms because you can place them in the vagina. But they can also be used for anal sex. And I can include a picture so that you can see what those look like. The next thing every single person should do is get tested regularly. Okay, so if you are sexually active, it's recommended that you get tested at least once a year. So you can do this at your regular doctor's checkup, or you can go to the student health center. Right? Just get tested as regularly as you can. And I would recommend, since you are all in college, to get tested a little more often if you can. There's also opportunities to get free tests on campus sometimes. Not exactly right now with COVID, but normally, there are buses that come to campus and you can get a free quick test. The University Health Center also offers free HIV testing, I think every Wednesday. So just make sure you're keeping up with resources and take advantage of all the free tests you can, because it can be expensive. You should also just get regular checkups, like regular physical exams. Okay? You always want to stay on top of your reproductive health, especially for women. It can be a little more challenging since our sex organs are internal. It's harder to keep track of. Okay, so you want to get regular checkups. And in terms of pap smears, it depends it depends on your age how often you should get checked. So the law has changed, or the regulations have changed over the years, just recently too. But it's recommended that you start regular pap smear screenings at the age of 21. But if you're sexually active, I would recommend to start when you are sexually active. So between the ages of 21 and 29, it's recommended to get them every 3 years. And then as you get older, it's a little less often. Okay, but if you are not in a monogamous relationship or you're having a new partner, I would just recommend getting a checkup as regularly as you can. It doesn't hurt to get checked more often. Next, this seems like pretty general common sense advice, but I guarantee you it's not being done by many people, but you need to make sure you're practicing just basic hygiene. Okay, so washing your hands and any other products you're using during sex before and after your activities. Okay, so please make sure you're just keeping everything nice and clean. Next, you should avoid alcohol and any other drugs that impair your judgment or senses. Okay, so as we know, alcohol impairs your ability to think critically, right? It literally impairs your ability to feel pain. It impairs your judgment senses. Okay, so just make sure you're limiting drugs as often or as much as you can in order to have safe sex. Next, you should make sure you're communicating with your partner. Now, I think if you are uncomfortable communicating with your partner about anything, you should probably not be engaging in sex with them. But make sure you're communicating, you have any type of safe words you need, right? Just make sure you're comfortable explaining what you do or don't like, or what you do or don't want, okay? And this should ideally occur before sex occurs. And then last, but definitely not least, is you need to make sure you're getting consent. So I know this is, again, it seems like a general common sense thing, but I guarantee you most people that are having sex aren't getting consent before. So there's many different ways consent can take place, right? You can have verbal consent, like, would you like to have sex? Or it could be like enthusiastic consent, which isn't verbal, right? But you can tell by their actions. So you just need to make sure that no matter what form you're obtaining consent in, that you do. Okay, it only takes a second and it doesn't diminish the quality of sex. So now we're going to go over some bias based on sexuality and sex education. So as you may or may not know, sex education is not required across every state in the United States. Okay? It's not even required that sex education be medically accurate in most states. Okay? Take a second to let that sink in. Sex education doesn't have to be medically accurate in some states. So most of what we're experiencing, and in Mississippi as well, are courses such as abstinence only, right? Or abstinence plus, which just teaches you that the safest way to have sex is to not have sex, right? Which doesn't make any sense. If you were taking a class on, or if you signed up for a driver's education course, right, to make sure you can drive safely and know all the rules, and then you came into class and I said, just don't drive, that's the safest way to drive, that would be ridiculous. You'd fail your test, right? It would hurt everybody involved. So abstinence only sex education is not effective, and we've seen this in every single capacity, right? States that teach abstinence only, like Mississippi, end up having the highest STD rates, the highest teen pregnancy rates, the highest repeated teen pregnancy rates. So it's just ineffective, and we know this. But on top of that, right, 0 states require that sex education curriculums be comprehensively inclusive to LGBTQ people. So in the United States, 4.5% of adults identify as LGBTQ. And most sex education courses are based on heterosexual and cisgender couples. So this really leaves a large portion of the population to be almost even more clueless than most students already are when it comes to sex. So some general LGBTQ practices, okay? So first and foremost, it takes a sperm and an egg to get pregnant, okay? Even if the individual are on hormones, like for example, a person assigned female at birth is taking testosterone, they may still be able to get pregnant or get to get somebody pregnant. So it's important that even though you may be transitioning or identifying as something, you need to make sure that you're always taking precautions to avoid pregnancy. So always assume pregnancy is a risk, no matter the situation. If an egg and a sperm is involved, then it's a risk. On top of that, for STIs, you need to make sure that you realize nobody is immune. So this is more common when in terms of women that have sex with other women, it's deemed as less risky. Okay, like there's less risk involved for STDs, STIs. That's not true. Okay, everybody is vulnerable to STDs and STIs. So stay up to date on screenings and vaccines, and consider PrEP, PEP, or birth control. So the PrEP is a pre-exposure prophylaxis, and you take this when an HIV negative person wants to reduce the risk of contracting HIV. So for example, if you are HIV negative and your partner was HIV positive, you could take this preemptively to reduce your risk of contracting it. And it's taken daily, very similar to a birth control pill, that you just take it regularly and it reduces your risk. Now you can take post-exposure prophylaxis, or PEP, within 72 hours of a sexual interaction to reduce transmission risk. So let's say you are HIV negative and you have sex with somebody, and then later you find out that they are HIV positive. You would take this very similar to how you would take like a Plan B or an emergency contraception. You take it within 3 days and it reduces your risk of contracting the virus. And on top of that, birth control is always helpful, right? Reducing pregnancy. And then, as I mentioned previously, right, barriers or condoms are always, always, always recommended. Now we're going to go over some common myths or dangers of sex that aren't often talked about. So the first one are douches, okay, or douching. So douche means to wash or to soak, but most of the time it's referred to washing or cleaning out the inside of the vagina with water or other mixtures of fluids. So most douches are sold in stores as pre-packaged mixes of water and vinegar, baking soda, or iodine. So it usually comes in a bottle or a bag, and you squirt it up through a tube into the nozzle, or the nozzle into your vagina, and then the water mixture comes back out through your vagina. So you're rinsing your vagina out pretty much. So this is extremely bad. Okay, so bottom line, you should never douche. There is no reason to douche. It is ineffective. No doctors recommend it. It is not something you should ever do. So about 1 in 5 women does it, and studies have not found any health benefits, right? Not a single one. So like I said, most doctors recommend you don't do it. It can change the necessary balance of vaginal flora or bacteria, and it can change the natural acidity in a healthy vagina. So it can also cause an overgrowth of harmful bacteria, which can lead to yeast infections, bacterial vaginosis, or if you already have a vaginal infection, douching can push the bacteria, causing the infection up into the uterus, your fallopian tubes, and ovaries. This can lead to pelvic inflammatory disease, which is a very serious health problem that we'll go over later. And it's also linked to many other health problems. So bottom line, there is no reason to ever use a douche. The next thing I want to go over are vaginal cleanses. This is very similar to douching, but sometimes women believe that they need to use a cleanse when they experience discharge. So discharge is a very normal part of having a uterus. Okay, so the mucus is produced naturally from the cervix, and it's usually discharged a little bit every day, and it can change based on your hormones. So your discharge changes throughout your menstrual cycle, pregnancy, and during menopause. So healthy discharge shouldn't have a strong odor or color. You may feel uncomfortably wet, but you shouldn't have any itching or soreness around your vagina due to discharge. But there are lots of bacteria inside the vagina, and they're there to protect it. So similar, like I said, with the douches, you don't want to disrupt that balance. So washing your vagina, it's a good idea to use or to avoid anything with perfume, and vaginal cleanses typically have like a nice fresh smell, so that's already a warning. We don't want to use anything with perfume. and you don't want to use any type of antiseptic, as these can affect the bacteria and pH levels of your vagina, which can cause irritation. So use plain, unperfumed soaps to wash the area around the vagina, as in your vulva. Okay, you do not want to wash anything internally. Your vagina already does that for you. Okay, so any type of wash you should use should be unscented and very plain. And vaginal cleanses typically are very odorized. They claim to help you balance your pH, but you should never be using them internally, so that doesn't make any sense. So they're pretty much a scam. I would avoid them as much as possible. Next is the pull-out method. So some people believe that the pull-out method can be used as a standalone method of birth control. And if you've watched some new TV shows lately, like Bridgerton, that this occurs throughout the show, and it's scary that it could lead to people, especially young women, believing that it's reliable. Okay, it's not reliable. And we'll go over this again later. But it's also called coitus interruptus, and this is when the partner with a penis pulls out of the vagina before ejaculating. And about 27 out of 100 women who use this method get pregnant each year. Okay, so it's not very effective, and it should never be used as the only method. Okay? Worst case scenario, okay, but it's not reliable. Just use a different type of method. The next myth is that if you have a lot of sex, your vagina will get loose. Okay, so this is completely untrue, and unsurprisingly, when we have a lot of these myths about effects of sex, they usually only affect women, right? Like, you've never heard anybody say if you have a lot of sex, your penis is going to get really smushed, okay? So it doesn't make any sense. The vagina is made of many, many muscles, and it is not going to get loose from any type of sex. Next myth is that you can't get STIs from oral sex. So, as I said earlier, STIs can be transmitted during any type of sex. Okay, oral sex, anal sex, vaginal sex. The next is that a person can't enjoy sex while wearing a condom, or condoms are uncomfortable, they're expensive, they decrease the amount of pleasure. Any type of excuse you can think of, you need to knock it down. Okay, condoms are very safe options of contraception, and there's no good reason not to use them. The next myth is just about everything in terms of masturbation. There are many, many myths in regards to every gender, every sexual orientation, that masturbation is a negative thing. It, increases bad thoughts. If you want to look up something really interesting, look up why the cornflakes were invented. I encourage you to do that. I'll give you extra credit if you look up why cornflakes were invented by Kellogg, and then email me how it relates to masturbation. But anyway, one of the main myths is that if you masturbate, that reduces your pleasure during orgasm, or it makes it harder for you to orgasm during sex. But this is actually the complete opposite. Masturbating actually makes your orgasms better, not worse, and they allow you to get more in touch with your body, or in tune with your body. So masturbation is normal for both genders, every gender. It's very normal, and nobody should be shamed for doing it. The next myth that you hear sometimes is that you can't get pregnant if you're in water, okay, or if you're in whatever type of liquid. But that's untrue, okay? You can get sex in a hot tub, in a pool, in a lake, okay? The last myth I want to talk about is that sex can be shameful, or that having lots of sex is shameful. And importantly, this is usually only used in terms of women having lots of sex. For men, having lots of sex is ideal, desirable, it's the goal, it's totally great. But for women, it can be seen as a negative thing. But no matter what, sex is never shameful. Okay, slut-shaming people for having sex with multiple partners is hurtful and misguided. The only person it reflects poorly on is the one who says it. Okay, so sex shaming is a terrible thing. There's nothing wrong with having lots of sex. Sex is pleasurable, fun, and a natural part of the human experience. Okay, so you should never feel ashamed for having sex. Now we're going to talk about all of the different types of contraception methods. Now I realize that there are going to be many you've never heard of. You would be shocked to know how little people know about birth control. It shocks me, but that's why we're here. Okay, we're going to cover pretty much all of these, and you'll know how to use them, how it works, and the effectiveness and the cost. So the worst type of contraception is the withdrawal method or the pull-out method. We've already talked about this very briefly. Okay. So the best way to use it is with another type of birth control. So it's unreliable. Don't do it if you don't have to. Okay. So the withdrawal method is free though, which is a plus, and it can be about 78, 75% effective if done reliably. Okay. So one of the things you need to notice is anytime I have a percent effectiveness on here, it's with a little asterisk that says if done correctly, which we know it's not. Okay, people forget their pills, people forget condoms, right? The effectiveness is if you do it perfectly. Okay, so withdrawal method is a really last resort. I don't recommend it. But next we're going to talk about how hormonal birth control works. Okay, so I would like you to think, have you ever taken birth control, or do you rely on someone that uses birth control? And do you know how it works? Okay, most people don't, right? So hormonal birth control does two things. Okay, first, it thickens the mucus on your cervix, which stops the sperm from swimming through to your egg. So when the sperm can't meet up with an egg, pregnancy can occur. Right? So first and foremost, it thickens the mucus on your cervix. Second, it also stops eggs from leaving your ovaries. Okay, so it prevents ovulation. So there's no egg to fertilize, and when eggs aren't released, you cannot get pregnant. Right? So I really need you to remember this. Hormonal birth control does two things: thickens the mucus on your cervix and stops ovulation. Now, hormonal birth control is typically used in a way that you take it for a few weeks and then you have a week off and then you get your period. Right? But it can also be taken continuously. This means that you take it 4 weeks out of the month and you never get your period. Now, I would really like to harp on this for a little bit because while this can be great, it's so nice to not get your period, it is linked to increased risk for osteoporosis. Okay, so we need estrogen primarily to build strong bones. And if you are overriding your hormone balance, right, our hormones typically go through waves through our cycle. If you're skipping your period every month, this can just lead to an increased risk of bone fractures later in life. So just keep that in mind. I'll probably mention again later on, but just be aware of that one danger. Now, the first type of birth control we'll talk about is the pill, and this is probably the most widely used type of birth control we have. So there are many, many brands, and there are different types of hormones used in the pill. Okay, so there's different methods. If you react badly to one type of hormone, you can take another version without that hormone. It's typically free thanks to the Affordable Care Act. It should be included in most health insurances, but you can also get it relatively cheaply for about $50 a month. But if you think $50 for a month, that can lead to a lot of money, but you can typically get it at a health department for free. And some states are letting you get prescribed it over the counter, which is nice, but not Mississippi. So it can be up to about 91% effective if taken regularly. Now, as I mentioned earlier, let me see if I can get my pen out. I'm not used to using this, so just a second. You will take the birth control following the instructions. So on this one specifically, it says start in the green section. So you would start on this day. And typically you want to line it up. You want to line up the start of your birth control with the date of your last period. And if you read the instructions that it comes with, you'll know exactly when to do it. So you take the pills in this formation, right? And you have 3 weeks of birth control pills. And then this last week is usually a different color, and this is the placebo week. So these pills are not birth control, and this is when you would get your period. So typically they're just sugar. You can totally skip them. You don't have to take them, but they provide them just so you can keep on a regular schedule of making sure you're taking pills every day. So that's the pill. Again, most common, very effective. You just need to take it reliably. Now, another thing I want to talk about is what should you do if you miss a pill? So that depends on your specific birth control. Like I said earlier, when you get your pills and you get your pamphlet, read it, right? Read it in depth. Look at the side effects, because there are lots of side effects for birth control that we will talk about later. All right, but read it. Usually if you forget a pill, you're supposed to take it as soon as you remember, but sometimes you don't take two the next day. So you just need to read it and make sure you know what you should do with your specific prescription. So next are the male and female condoms. Again, these can also be called internal and external condoms. So male condoms are what you usually think of. They're thin, stretchy pouches that you wear on your penis during sex. They provide great protection from both pregnancy and STDs. So barriers are the only things that prevent against STDs. So they're 85% effective when used correctly. I put free, but they are very inexpensive. But especially being a college student, I guarantee you can get some for free on campus in the health center or in different departments across campus. Now, next one is the female or the internal condom. Again, it's called female condom because it was designed to be used in the vagina, but you can also use it for anal sex. So this one's different in that you have to insert it 30 minutes before sex if you're going to use it in your vagina. And you can leave it in for up to 8 hours. So you could insert it, go out for a night on the town, use it, and then remove it, okay? If you use it for anal sex, you can only leave it in for 30 minutes because it's different than the vagina, right? The vagina has an ending. It can't go up any higher. But when inserted in the anus, which can suction, it would eventually pull the condom in all the way, okay? So it's suction it up over time. Internal condoms are about 78 or 79% effective. They can be free. They are free on campus. Or you can get about 12 for $20. So this is what the internal condoms look like. They are a lot larger than a male or external condom. So if you look in the bottom right, let me get my pen out. You'll see that there are two rings. Okay, there's a ring here and a ring here. Now this ring, the smaller ring, is placed internally. So similar to like a Nuva ring, you would squeeze it in this kind of shape. Let me see if I can draw this. You would squeeze it so it's thin and in an insertable position. And then you insert it through the vagina and it rests comfortably. Okay, so once it's inserted, it should rest in there by itself. And then this larger part hangs outside of the vagina. Okay, you can see it here and here. And then the penis or whatever you're using is inserted through the condom, okay? And it provides very safe protection. Now, like I said in the last slide, it can be used for anal sex, but if you use it for anal sex, you need to remove the smaller ring, the internal ring. Okay? You do not insert the ring anally. It can be removed. It can just be pulled out of the condom, okay? So as I said earlier, for vaginal sex, you insert it 30 minutes early, and then for anal sex, you insert it when you're ready, and you try not to keep it in for very long. Next is spermicide. So spermicide is a chemical that you put deep into your vagina right before sex. It prevents pregnancy 2 ways. It blocks the entrance to the cervix, so sperm can't get to your egg, and it's stopping sperm from moving well enough to swim to your egg. So it blocks the entrance and also makes it, you can imagine, like really sticky, really hard to swim through. So it produces a barrier. Spermicide can be used in creams, gels, film, foams, and suppositories. A suppository is like a small bullet type shape that you insert yourself. So you insert it and it melts into a cream inside your vagina. So you insert it about 10 to 15 minutes before sex. Okay, so it's not something you can do after sex. It's 72% effective. I'm sure that depends on the type you're using, and it's about $8 to $15 per kit. Now, like I said, spermicide isn't extremely effective. It's encourage that if you do use it, you use it with another type of method like a condom. Okay? So about 28 out of 100 women will get pregnant every year. And it also, spermicide can increase the risk of urinary tract infections. Vaginal irritation such as burning or itching or a rash is the most common side effect of spermicide. It can also cause an allergic reaction. So it doesn't prevent STIs. If you're using it frequently, it can even further increase your risk of vaginal irritation, which may increase the risk of contracting HIV or other STIs actually. So you shouldn't use spermicide rectally because it may cause irritation and increase those STIs further. It can also potentially cause penile irritation or burning urination in your sexual partner. The next type is a sponge. So there are a few different versions that we'll go through, but a sponge is a small round sponge made from soft, squishy plastic. So you put it deep in your vagina before sex. The sponge covers up your cervix and contains spermicide, and this helps prevent pregnancy. Each sponge has a fabric loop attached to it to make it easier to take out. So again, looking at this picture over here, you can see that it covers up your cervix, right, which would in essence make it very difficult to get pregnant. It also has some spermicide in it, and then you pull it out with this loop attached to it. So for $15, you can get a Today sponge, which is a name brand, or for about $12, you could get 3 of them. So it's 88% effective for women who have not had birth or given birth, and it's 76% effective for women who have given birth. So giving birth increases the size of your cervix, which can make it harder to cover it. So you always leave the sponge in place for at least 6 hours after sex. Or this is different than the other ones we've talked about, but you don't want to leave it in your vagina for more than 30 hours total. Okay, so you have to leave it in for at least 6 hours, and you can only use it one time. It's disposable. The cervical cap is similar. You put it deep inside your vagina and you use it with a spermicide. So you always leave it in place for at least 6 hours after. Don't leave it in for more than 2 days. It's less effective if you have given birth. The next one is a diaphragm, also very similar. You can insert it up to 2 hours before you have sex, leave it in for at least 6 hours, no more than a day. After you take it out, you need to wash it with soap and warm water and let it air dry. So the diaphragms are reusable, which is at least a bonus. They're about 88% effective, and they can be $0 to about $250. And you can see what it looks like here. Diaphragms and sponges and caps are a little outdated. You've probably heard people talk about their diaphragms from 90s sitcoms, but they're not used that often anymore. Another method most people don't know about is the lactational amenorrhea method. So you might be familiar with the term amenorrhea. That means the stopping of a menstrual cycle. So breastfeeding actually can stop ovulation if you're doing it excessively. So excessively means that you nurse or you breastfeed at least every 4 hours during the day and every 6 hours at night. So you can imagine if you have a newborn child, that's a pretty normal amount of time to breastfeed. So about 2 out of 100 people who use breastfeeding as birth control get pregnant in the 6 months. So it is pretty effective. I think of it as the body's way to reduce the likelihood of you getting pregnant right after giving birth. But it only lasts for a couple months, so you need to breastfeed excessively. It prevents ovulation. You won't get your period for a few months after you give birth. Next is a calendar method. Now there are many different types of calendars, but essentially it's all based around the calendar. So there's like a rhythm method, a mucus method where you check your discharge every day, or temperature method, you take your temperature every single morning, or an ovulation calendar. So the days near ovulation are your fertile days, okay, when you're most likely to get pregnant. So people that use calendar methods to prevent pregnancy avoid sex or using birth control or use another birth control method on those unsafe, very fertile days. Now, I just want to put a little asterisk here. Most people use this method to get pregnant. right? Like I'm going to have sex on my fertile days to increase my chances of getting pregnant. So if you want to use this as a form of birth control, just make sure you're using the right type of calendar or that you understand it well. So safe days begin after the increase in your temperature lasts for at least 3 days. So if you take your temperature every single morning, you'll see differences. And you can track where you're ovulating based on that. So this is what the calendar looks like. So it's easiest to just start when your period starts. So on your first day of your cycle, that would be day 1. Okay, so you're least fertile while you're on your period. The next few days, it's possible to conceive, but then here you have the ovulation window, which is when you're most likely to get pregnant. Okay, and then your uterine lining thickens for your period, and it's a little less likely. So to use this as a birth control method, you would want to avoid these days. The next birth control we'll talk about is the patch. And this is a transdermal type of birth control, meaning it goes over your skin, through your skin. So the patch uses estrogen and progesterone, and it lasts 1 week. So one patch lasts 1 week, and when you are prescribed it, you get 3 in one box. So you have enough for 1 month. So the patch has to go on certain areas of your body. It can go on your hips, on your buttocks, on your shoulder, or on your arm. Now, every single week, you need to alternate locations. So if you place it on your hip, you would place it on the right side 1 week and then on the left side the next week. If you place it on your buttocks, you would go on the right side 1 week and the left side the other week. Okay, so you have to alternate. The side effects of the patch are very similar to other types of birth control. One specific difference is that it can cause skin irritation, which makes sense since you're putting it on your skin, right? So similar to like a Band-Aid, if you left it on for a long time, it can cause itching and redness of the skin. So the patch is pretty effective, about 91% effective, and again, it can be free with insurance or it can cost up to $150 per month. The next one is the vaginal ring. So again, this is hormonal and it lasts 1 month. Okay, so the ring lasts 1 month. You need to wash your hands with soap and water before inserting it, and then you squeeze the sides of the ring together with your fingers and gently push it into your vagina. So you push it into this shape you can see in the picture, just like the internal condom. That's how you would squeeze the inner ring, insert it. Okay. Don't worry about the exact placement when you insert it. If you can't feel it when you're walking around, then it's incorrectly. If you leave it out for more than 2 days, you're not protected from pregnancy. And it can be worn during sex, but it also can be felt during sex, so it wouldn't be totally unnoticeable. It's also very effective, free if you have most insurances, but it can cost up to $200. Next one is Depo, Provera, which is often just referred to as Depo. So this uses progestin. It's injected by a doctor or a nurse, and it's usually injected on your lower back, buttocks region, and it lasts for 3 months at a time. So if you were to take it, you would only need to take it 4 times a year. However, it is not recommended for long-term use. Okay, so this is a big red flag we never talk about. Depo is not supposed to be used for a long time. Okay, you should not use it. I think it's for more than 2 years is recommended. Now, similar to other birth controls, this is a continuous birth control, meaning you inject it, right? So you're getting that dose for 3 months. You will typically not get your period during those 3 months because there's no time you're like taking a placebo week, right? So it's continuous, which again increases your risk of osteoporosis later. On top of that, there are just many scary side effects of Depo. I would not recommend taking Depo if you don't have a medically necessary reason. It is pretty effective and also usually covered by insurance. But if you are on it or if you're interested in taking it, I would just recommend doing a lot more research before using it. So again, it is continuous, meaning you don't get your period. The next one is the implant. So this one is pretty popular. It goes in your arm, and this is about the size of it. So it's very small, like a little matchstick is what they usually call it. Now this lasts for 4 years. So again, it is also continuous because you're not taking it out for a week every month. It's extremely effective. and it is usually covered by insurance. Otherwise, it can cost up to $1,300. So what they do is they make a small incision in your arm, and then it's injected with a gun type instrument, and then it heals pretty much about after a week. So you can feel it when it's in your arm, but it should never be painful or hurt. And then it's removed after 4 years. It can be left in longer. Like, there's no reason you should leave it in longer. It just wouldn't be effective. You just have something in your arm. Next is an intrauterine device, or an IUD. So there's two types of these. There are hormonal ones and there are non-hormonal ones. So the hormonal ones work just like birth control, right? They thicken the mucus on the cervix and they prevent ovulation. However, there's also a copper one, which is called Paragard, and copper is a natural spermicide, meaning it kills sperm just naturally. Okay, so if you are interested in getting off of hormonal birth control because there are a bajillion side effects, the copper Paragard is highly recommended. Now in the brackets you can see how long each of these last, and this is in terms of years. So Paragard lasts up to 12 years, Mirena 6, Kylena 5, and Skyla 3. So some of these are recommended specifically for women who haven't given birth, but you need to consult with your doctor in order to see which is best for you. They're more than 99% effective. They're one of the most effective methods we have, and they can be covered by insurance. Right? There are a lot of scary stories about IUDs, right? People have them fall out on them or like implant into the uterine lining. So I would make sure, again, you're reading to see if you want one. Now the way that it's inserted, if you look at this picture, is it is inserted in a straw-like tube, okay? So it's inserted into the vagina, and then the arms kind of pop out once it's inserted. So it's not, placed in as the shape. It's placed in a tube, and then the arms pop out once it's inserted all the way. So don't be afraid about that part. The next two we're going to cover are sterilization, right? So the first one is a vasectomy. This is for people with a penis. There's an incision and a no scalpel version. So what happens is, here we have a picture of a penis and the testicles, right? From the testicles, and we know, hopefully, that the testicles produce sperm, we have a seminal vesicle, right? So this is where this sperm come out, right, through this. And this is called the vas deferens, okay? So your sperm travel out through the vas deferens. So during a vasectomy, we cut in some shape, we cut this tube, right? So it could be like we staple it, we cut it, we cauterize it, right? But that is how a vasectomy is performed. Get my pen back. So after you get a vasectomy, you have to wait 3 months in order to be semen and sperm, for your semen to be sperm free. So after 3 months, you'll go back to the urologist, you'll give another sample, and they'll see if you have any sperm in your semen. Okay, so once you are cleared by the doctor, then you could have sex, you could have unprotected sex. So vasectomies can be reversed, but it's very complicated and it can be expensive. So if you're interested in a vasectomy, just make sure you're sure, right? Don't plan on getting it reversed. It can be covered by insurance or cost up to $1,000, and it's almost 100% effective. It is also an outpatient procedure, so it's not invasive. You heal very quickly, right? If you get it on a Friday, you'll be good to go back to work Monday, and there aren't many complications. So vasectomies are a really good option if you're not interested in having children. The next one is for people with uteruses, is tubal ligation, or we usually call it tying your tubes. Okay, so this is a surgical procedure that permanently closes or blocks your fallopian tubes. Now, take note here, you still get your period after tubal ligation. You just can't get pregnant. Okay, so when you get your period, your uterus is shedding its lining, right? That's what the period is. So just cutting these fallopian tubes isn't going to affect that at all, right? So just keep that in mind. A lot of people are confused by that. Let me erase this. Okay, so similar to the vasectomy, it takes 3 months to start preventing pregnancy. And again, it's meant to be permanent, so it usually can't be undone. It depends on what type you get. Some people, like I said earlier, kind of get like staples, or you can just cauterize the tube, which is, burning it closed. And also some people just get sections of their tubes completely removed, right? That cannot be undone, but it does actually prevent ovarian cancer, or fallopian tube cancer. So getting your tubes completely removed, or a section of them, is a pretty good option. So again, it can be covered by insurance, or up to $6,000, and it's more than 99% effective. So vasectomy and tubal ligation are both considered sterilization, and they can be extremely beneficial, right? You don't have to worry about it. You do it once. Now, tubal ligation can take up to a week probably to recover. So what happens is, they stick you in 3 small areas, fill your abdomen up with gas, and then perform the surgery that way. So most of the discomfort is caused from the gas during the procedure. But this is an inpatient procedure. It's not outpatient, right? It is surgery, and you are unconscious during it. The next type of contraception is emergency contraception. So the number one brand we usually talk about is Plan B, but there are other versions. But it is over the counter. Anyone can purchase it. There are some different rules across states. So some states require you to be a certain age when you purchase it, and some, there are just lots of different rules. So check your state. You usually can get it over the counter. You can also order it online. There's also a different version like Ella, which is prescribed. Okay. So it uses the hormone, I cannot pronounce this very well at all, but lovinestral, and it lowers your chance of getting pregnant by 75 to 89% if you take it within 3 days after unprotected sex. Okay, so even if you have protected sex, say you're using a condom, and you realize the condom breaks, you can take emergency contraception to reduce your risk of getting pregnant. Now, there are many, many, many misconceptions about emergency contraception. It is not an abortion pill. If you are pregnant, it will not make you lose the fetus, okay? It is only a type of birth control. It is a stronger dose of birth control. Okay, it thickens your mucus, prevents sperm from getting to your cervix, okay? You can take it up to 5 days after unprotected sex, but you should take it as soon as you possibly can. Now, it ranges from like $40 to $60 in person. I think Plan B is typically known for being about $60, but you can get cheaper versions online also. Again, it's not an abortion pill. It is just a big dose of birth control. With that said, it can mess up your cycle since it is a larger dose. So it wouldn't be surprising if you did like get your period right after, or if you like skipped your next period, because it just messes up your hormones since it's a larger dose. So emergency contraception is pretty effective. It's a good thing to have on hand if you ever have a mistake that occurs. The next option and the last option is abortion. Okay, so this would be after you get pregnant. These are your options for no longer being pregnant. So there's 2 types of abortion. There's a pill and there's in-clinic abortions. So abortions in general are one of the safest medical procedures we have, right? There's very low risk involved with abortions. So the pill uses hormones to cause cramping and bleeding to empty the uterus. So it can be taken up to 10 weeks after the first day of your last period, and it really just induces a very strong cramping, right? It's just like a really, really, really bad period. And it's safe to do at home. You can, like I said before, you can usually do it on a weekend and be okay to go back to work, physically at least, right? And then for in-clinic abortion, this is a medical procedure that uses suction to empty the uterus. So this is typically done a little later. If you're pretty early in your pregnancy, you'll most likely use the pill, and then in-clinic abortion for later ones. So like I said, abortion is one of the safest medical procedures. It's safer than being pregnant, despite what people say. 1 in 4 pregnancy worldwide ends in abortion. 3 out of every 10 women in the US will have an abortion by the time they're 45 years old. So it's more common than people like to admit. And most people recover after a day or 2. So lastly, I just want to talk about some general side effects from hormonal birth control because there are a lot of side effects and it's not always talked about as often as it should be. Okay, so most of these side effects claim to only occur within the first few months until your body gets used to it, but a lot of these can progress throughout the whole time you're taking any type of birth control. So if you are experiencing any side effects, make sure you try to switch, right? You don't have to stay on the same one just because that's what you're used to. And like I said, with the pill, there are many, many versions. So if you're having a side effect, it could be due to the estrogen in the birth control. So you could get on a birth control without estrogen, okay? So just make sure you're advocating for yourself. If you have any of these side effects, or again, look up your specific one you're on and look up the side effects, that you talk to your doctor and try to change. But some common ones include weight gain, headaches or migraines, sore breasts, irregular periods, mood changes. And these mood changes can be as extreme as depression. Hormonal birth control has been linked to increased depression in women, or decreased sexual desire, or low libido, acne, nausea, dizziness, or changes in appetite. So again, just make sure, keep it in check, change prescriptions if you need to. Okay, and that is the end of this lecture.